Hey guys, Charles Falgu here, founder of Proper Health. Yes, I'm the guy saying health insurance sucks. I stand by that. I dropped traditional insurance in 2016. It was one of the smartest decisions that I've made. Today's video, I'm going to go over the benefit comparison. I'm going to lay out why I believe Proper Health is just a smarter solution for most people. Now, last week I did a number crunching video, so for those of you cerebral that just want to know the numbers, I think you'll like that video. So without further ado, let's move to the comparison. Okay, so here's traditional insurance, here's Proper Health. First thing I'm going to cover is primary care. You know, we do things a little differently at Proper Health. We unbundle healthcare into three different categories: primary, secondary, and catastrophic care. We do that so that way we can make healthcare more affordable for more people. You know, the government basically put these things in metallic categories, and even the bronze plan, as great as it might be, because it is comprehensive insurance, it's still very expensive, and it gets people not wanting to buy it. And now, of course, with 87,000 new IRS agents, people are second guessing if they even want to get a tax credit. But anyway, okay, deductible. Traditional insurance is always going to put hurdles in your way. Their national average is 4,800. I think that's actually kind of low for Texas. I think our average is a little higher. Proper Health, we don't put deductibles. Co-pays, they're going to charge you $40 to $90 every time you go see a doc. Again, Proper Health, it has no co-pays. Networks, if you're in the individual market, you're buying either an HMO or EPO. If you're lucky enough to get insurance through your employer, you might have a PPO. But I got to tell you, they're paying a pretty penny for that. That's about a 15% load. Proper Health uses a PPO product. You're free to go anywhere you want, but actually, your doctor is going to be right on your smartphone, and you have a selection of over thousands of physicians right online, and so you'll have access to his or her calendar, so you won't have any problems with networks. Primary care physician visits, talking to the doc, you'll have a copay with them, zero cost with Proper. Mental health, so if you suffer from anxiety, depression, family issues, substance abuse, get some help. With traditional insurance, of course, they make you jump through a deductible first. With us, you do not. Dermatology, that's a specialist type of visit with traditional insurance, so you have to pay your deductible. If you have a skin issue, take a photo, send it up to your care team, and within 48 hours, you will have a prescription sent to a pharmacy by you at zero cost. Nutritionists, this is part of our wellness package that includes dietitians, it includes sexual health doctors. With traditional insurance, it's not covered. With Proper Health, our goal is to try to keep you well. Of course, as good as doctors are, they're not going to know what's wrong with you until they do a little blood work at times. And if you do it in their office, they're going to upcharge you. With us, you go to a Quest Labs. There's over 18 locations in San Antonio, and you pay zero for your blood work. Again, same thing with imaging, and we're talking ultrasounds, CAT scans, MRIs, mammograms. The insurance companies make you pay a deductible and copay. Proper Health, you pay zero. And finally, prescription drugs, that's, kind of how we handle healthcare nowadays. Insurance companies use formularies, and a lot of times they're more expensive than the cost of the drug itself. We use a wholesale vendor that is just pure pass-through pricing, similar to GoodRx, but we beat GoodRx on many of the drugs, and they do beat us on a few. And then last but not least, pre-authorization. This is huge, guys. With insurance companies, you have to ask permission. That can be a week, 2-week wait. With us, no permission. Go get it taken care of. So on a premium level, again, traditional insurance, since they don't unbundle, you can't buy strictly primary care. With us, $150 a month, and that's going to resolve 90% of what you need health care for. And I got to tell you guys, with a safety net called Obamacare, for you young people, that's pretty much all you need. If you are diagnosed with something major, we always can put you on a safety net plan. Anyway, so let's move on to secondary care. This is when you've already gone to the primary, you've gotten the blood work, the imaging, there's abnormalities in those diagnostic tests, and you have to have some surgical procedure or some other intervention. Insurance companies are going to make you pay a deductible, and then co-insurance. We teamed up with a Texas billionaire family that created a banking product that really creates an accelerated savings, and we pay cash directly to vendors because we know for an absolute fact that when you have health insurance, you pay a higher reimbursement rate. There's no doubt about that, and that's really my next subject matter. So when you have to have a procedure done and you have traditional insurance, you are agreeing to their reimbursement rate. And so let me kind of explain that a little bit somewhere else here. So we use a company called Prater. Price matters. Dr. Hennessy is the founder of this. Here is Dr. Hennessy right here with President Trump at the signing of the price transparency. He is really big on pricing. So he has a database and he knows exactly how things work. I've studied it now for about 2 years. So here's the CPT codes. These are codes that insurance companies use in determining what kind of procedure and what the reimbursement rate is. So you're always going to have Medicare. Medicare is always going to be by law the lowest priced vendor. Hospitals and doctors cannot charge you lower than Medicare or they would lose their license. It would be fraud and the government would shut them down. And then here's the insurance rate and here is the cash price. So if you had to have $14,350, repair of tissue, loss of a finger, with Medicare you would pay about $3,000 between the hospital and the physician. With an insurance company you would agree to pay $8,000. With us, it would be about $3,600, give or take. And so that's really kind of the question. You got to ask yourself, would you rather pay $8,000 or would you rather pay $3,600? Here is code 15002, and it's maybe $1,500 with Medicare. You would pay $3,800 with insurance and $1,700 with us. Again, you can go down here, 15.2, relocation of patient skin. Again, it goes into a deeper explanation. With Medicare, maybe $3,000. With insurance, you would pay $8,000. And with us, it would be, about $3,500. And we've actually put these codes, let me see here, surgery list. So, here's a lot of the codes right here. So we know what the insurance price is and what the cash price, and then we know vendors that are willing to do this at a free market price that's going to save you a lot of money. So we always tell our members, hey, if you have to get something done, give us a call and we will assist you in finding the right price. And of course, we're building up your bank account really quick. And if you want to see how that works, go over to the number crunching video. Dental, vision, hearing, insurance companies make you buy separate policies. These are big profit motive plans, and they put caps on your benefits. With us, it's all covered under your banking product. Elective procedures, again, it's not covered with traditional insurance. So, if you're trying to better yourself through bariatric surgery, plastic surgery, cosmetic dentistry, maybe there's fertility issues, insurance companies aren't going to cover it. We do cover those things. Naturopathic care, a lot of us are now starting to second guess this whole Western medicine, and so Proper Health, we cover the naturopathic route. So again, on a premium base, traditional insurance, it's not applicable because they don't separate things. With us, it depends on how much you want to save. You can get really aggressive and build up a $60,000 account as soon as 35 months. Or you can start as slow as you want, whatever's in your budget. So the last thing, catastrophic care, again, with traditional insurance, it's mandatory They don't, you have to buy it. It's part of the plan. With proper health, it's optional. So, if you have a lot of assets that a hospital district can pursue, by all means, yeah, you want a catastrophic policy. But, if you're a young guy and you really don't have any assets, I don't really think that's the best place for you to put your resources, because the fact of the matter is there's a lot of hospitals out there that get billions of dollars, or millions, I should say, from the Affordable Care Act, and by law they have to give free care. And so we direct our clients to those hospitals in many cases, and we fill out the paperwork in order to get those hospital bills erased. But on the insurance, it's usually covered 100% after 15,000. With us, it's 100% from 50 to 5 million. Again, the premium's not applicable because they don't unbundle it. You can buy a catastrophic policy with us for $99. If you bundle it with our other products, we give you a discount. So, the total premium's $510 under a traditional. Us, the primary $150, the catastrophic could be $79, and then depending on how much you want to save. If you saved $150, it would run you $379. I didn't put the bundled price in there. But anyway, if you agree with me that this is a better route, then give me a call. Let's talk. If you don't, thank you for your time. I appreciate it.